People wonder whether or not their small child could have an ear infection and what are the symptoms, especially in a little baby that's unable to tell you. Ear infections are almost always associated with fever and with cold symptoms, with irritability and poor sleep. Many little babies will just pull at their ears when they're teething or just because they've discovered their ears, and a happy smiling child with no fever who's pulling at their ears will very, very rarely have an ear infection. The child that we're concerned about, that we want to see, is a child who's had some cold symptoms, some fever, perhaps some restlessness and sleeplessness and poor appetite. And of course, that little baby can't tell you they have an ear infection, and we need to check them in the office. If indeed they have an ear infection, in most cases for very young children, 6 months to 24 months or 2 years, we will treat that ear infection with an antibiotic and follow up in the office in a few weeks. For older children, or children with only one ear that's infected and one ear that's not infected, if they have a low-grade fever, if they're sleeping fairly well with minimal symptoms, we can sometimes watch that child for a couple of days, give them some pain relief such as ibuprofen or acetaminophen, and re-see them in the office again in a few days, or alternatively give an antibiotic prescription to the parent and have them watch the child for symptoms of fever, fussiness, etc. But a recent report by the American Academy of Pediatrics with experts in both pediatrics, infectious disease, and ear, nose, and throat suggest that the watchful waiting for children with a one-sided ear infection or older children with more minor symptoms is a reasonable course of action.